Ram,
First.
you'll get your chance.
Supine and 3 minutes standing with the different of systolic
Any
BP.
first, second, or third? Left or right?
First, sir. Left or right?
What is second?
20. Difference of systolic is 20, sir. So it should be posted.
This is again orthostatic?
Yes, sir.
Okay,
Systolic
next, Srinivas.
In the second one, there is a drop in systolic by 30. But
there is no difference in the BP in the first and second. There is only difference in the pulse at 3 minutes.
Yes.
Kruti.
Hypertension, second.
That is orthostatic hypertension. What is second? Garvita. Robin.
That is also orthostatic hypotension.
Next, Ashok.
Sir, same, sir. Orthostatic hypotension.
Hemant. Any different answer? ST batch. Petrol. Speak into the mic.
Autonomic dysfunction.
Correct. And what is the third one?
It is
hypertension. Frank hypertension or shock. So what is the difference in the first and the second is that there is no increase in pulse rate when the patient is having fall in BP. So that is autonomic dysfunction. There should be a reflex tachycardia. Ventrival. Fever impact with every 1 degree rise in temperature. What is the effect on pulse?
The pulse rises by 10 every 10 degree 1 degree rise in Fahrenheit.
Okay. Next, respiratory rate.
So it increases by 5 to 6.
Next, Chandrasekhar. Okay, it is 1 to 1.5 breaths per minute. Oxygen consumption in percentage.
3%.
13%. Sit. So what is Fagett sign? Any first year? Harish.
Not obvious.
Not right. Shrinu.
The relative bradycardia.
Relative bradycardia.
With
Any
the rise
Peds
of
resident?
temper-
Correct.
Sir.
Please sit. Peds resident. Pediatrics resident. Do you see Fagett sign in pediatrics?
Yes, sir. In the cases of enteric fever, typhoid, we do see it.
So do you know any prerequisites of Fagett sign? ST batch. Ashok? Don't know. So the prerequisites are the patient's age should be at least more than equal to 13 years and temperature minimum is 102 degree Fahrenheit. Pulse must be taken simultaneously. So, Robin. Answer jaldi display ho gaya. Yes. Tell the corresponding pulse. What do you expect in a normal individual who is having temperature of 106, not on any drugs or beta blockers? What the corresponding pulse should be?
Sir, 120.
106.
150, sir.
No. 105.
Sir, 40, sir. 140, sir.
Correct. Sit. So, Ashok, relative tachycardia. Have you heard of this?
No, sir.
Anyone? Any ST? No? So, relative tachycardia is disproportionate increase in pulse with respect to temperature. That is seen usually in conditions like non-infectious and toxin related in gas gangrene. What are the causes of relative bradycardia? Problem. Classify.
So infective, non-infective causes. In infective, we have, sir, typhoid, enteric fever, sir. Then, sir, rickettsial infection, skew fever.
Garvita, you'll get your turn.
Sir, even in dengue, sir, we can get relative bradycardia.
Any other viral infection or bacterial infection or protozoal? Ashwin. Mike.
Other than enteric fever, sir, yellow fever, brucellosis can cause
Correct.
relative pericardia. Sir, Legionnaires,
Legionnaire.
some drugs can cause, and some malignancies like leukemia can cause relative
Okay.
pericarditis.
Any drugs specific?
Beta blockers,
Beta blockers. Any CNS lesions? So these are the some common causes of infectious causes, out of which gram-negative common include typhoid, brucella, lepto, legionella. Tick-borne includes rickettsial, scrub. Others includes diphtheria and malaria, and viruses yellow, dengue, chikungunya, and myocarditis. Non-infectious drug fever, beta blocker use, CNS lesions, and malignant lymphoma, and factitious fever. Next. Next. Yes. Ram.
So, erythematous lesion involving the palms.
Which one? A, B, C.
A, sir.
Oh, okay.
Sir, this is blanchable erythema in the B, sir. And fluid-filled lesion, likely vesicles.
Vesicle. It's a bullae.
Bullae, sir.
Is it? Can you tell any condition which can include all three conditions, which can have all three kinds of skin lesions? Any tropical infection? Name anyone. Good. Next, Kranti.
With A and B, we'll see in
No,
dengue.
that's okay. Next. It'll come. Next. Disclaimer for the first image is that the patient had absolutely fair skin prior to this infection. Absolute fair. Now tell. Ram, you'll get your turn.
Chikungunya. Post chikungunya infection, we'll see.
No, what is
chicken,
finding?
in rightmost the chicken.
No,
picks.
left top. Hyperpigmentation.
Left
and
upper
in-
is hyperpigmentation.
Lower picture.
Ulcers over in
Ulcer.
mucosal area.
And the third image.
Third
Charlie, see
Hyperpigmentation over
over the nose.
nose.
Okay. Akash, next. Fix it.
At admission, his systemic examination, neurological examination, and admission revealed a normal higher mental function. Speech and cranial nerve examination was normal. He had normal motor examination. There were no sensory deficits, no cerebellar signs. Gait was normal, and there was no evidence of meningism. His other systems were unremarkable.
Major Kalpana.
So there is leukopenia in the patient. The counts are reduced.
Goes
So
in favor of viral, bacterial, protozoal, fungal.
goes in the favor of viral infection, sir.
Okay.
This can be because of dengue virus, Zika virus, chikungunya, yellow fever.
Out
So
of these three, which one do you think it is?
it is more, as the case is going, sir, it's most probably chikungunya
No,
or dengue.
Just based on this investigation.
Based on the investigation that the platelet counts are normal in this, and only this is leukopenia which is being elicited in this report. So it's going in the favor of chikungunya.
Correct. Please it. The right-sided investigations are for microbiology. Microbiology. Focus on the blue one. These investigations were sent on day 1 of admission, means day 3 of illness. Is it correct or wrong?
So these investigations are probably negative because they were sent too early. Because chikungunya, leptospira, scrub, all these IgM first antibody which is detected starts after at least by 4th day.
By
Because
which day?
sorry,
Which day of illness?
4th day.
4th day. And what about malaria? Malaria, dengue. can they
Malaria
come
also
positive?
rises after at least 4 to 5 days. First day it will be negative, sir.
Which one?
Malaria.
Malaria. Okay. Please say. Next. Next. So what is this syndrome? Dr. Rajesh. The one that we have discussed, fever, polyarthritis rash. Does it have any localization?
Systemic involvement.
Yeah.
No.
Does it have any localization?
No, sir.
No. So what do you call it?
Acute febrile illness, sir.
So I say this is PUO. Am I
No,
correct?
sir. It is less than the PO definition of 21 days.
Please define PUO.
PO is in a patient of immunocompetent individual with a temperature of more than 100 degrees. On two occasions, more than 101 degrees. And
Illness duration of
illness duration of 21 days.
21 days. And after
After
history
all the
examination
history
and
examination, investigation workup proved negative.
okay. Next. Please define AUFI. Dr. Vijay.
Acute undifferentiated febrile illness, sir.
Please define. Next, Srinivas. Next, Kranti. Robin.
Sir, as per ICMR, sir, the definition is an individual, sir, immunocompetent individual, 18 to 64 years of age, sir. If he has fever of 2 days to 14 days duration, sir, with no apparent localizing sign on history or examination, sir, is defined as acute undifferentiated febrile illness.
Correct. Please sit.
He was diagnosed.
So
and
this was this syndrome is AUFI, acute and undifferentiated febrile illness.
He was diagnosed and was being managed symptomatically as viral fever with hydration, antipyretics, analgesics, and supportive care.
Okay. Hemant, what is the maximum recommended dose of paracetamol per day?
Sir, in adults it's 4 grams per day.
As per FDA. So
As
FDA
per
has
the-
recently reduced the maximum dose
To 3
from
grams.
4 to 3 grams. And what if the patient has liver disease? Maximum 2 grams
2
per day. Correct. Sit.
On day 4 of hospital admission, that is day 7 of illness, he was noticed to have slurring of speech with preserved comprehension. He was swaying on both sides while walking. He had difficulty in reaching out to hold objects in the form of overshooting and undershooting the target. He gives history of smearing of face while eating. There was no history of any weakness of any limbs, any facial deviation, no sensory symptoms. There was no history of any loss of consciousness or seizure-like activity, and there was no history of any altered sensorium.
Vetrival. Tell.
This diatocokinesia, we are testing this diatocokinesia.
Which side? Left or right?
Both sides we have tested,
Both.
sir.
Okay. Next, Chandrasekhar.
Pause pointings. Finger, nose. Finger, nose, finger.
Which side?
Both.
Okay. Sit. Next, Sempur.
The heel shin test.
Full name of this test? Heel, knee, shin, toe.
Heel.
Which side?
Checking
Bilateral.
both sides.
Sit. Okay. So these are the signs of cerebellar dysfunction. Hassan, other signs of cerebellar dysfunction. First, tell the cardinal sign.
There can be ataxia, nystagmus.
Ataxia.
Then there could be dysmetria, dysdiadochokinesia. There could be intention tremors.